to start over.
Thank you.
Hello, and thank you for attending this presentation on dangers of smoking and vaping. My name is Kelly Gerard, and I am a health resource advocate with District Health Department number 4. And that role is a role to assist students, parents, families, guardians, as well as staff with educational things, such as communicable diseases, education on how to help manage those, and then specific topics that we've been asked to prepare, including the smoking and vaping presentation. Just a little bit about me. I've been a registered nurse for 38 years, 34 of those years at the hospital, 2 years with long-term nursing care, and currently at the health department. I've retired twice and just can't seem to stay retired, so here I am. So what is an e-cigarette or vaping? The e-cigarettes are electronic devices that provide a heat source to produce an aerosol or vapor that you inhale. Kind of liken that a little bit to if you have had a nebulizer breathing treatment. You start with a liquid and it aerosolizes to help get it further into your lungs. There's lots of different forms, such as tanks, mods, they're rechargeable, disposable, and they come in all shapes and sizes. Some of them look like a regular cigarette, some look like a pen or a cigar, and a USB flash drive, which is very popular as they're kind of easy to conceal and easy to sneak a vape off, maybe in places you're not supposed to. Most all of the mods or the vape liquid has nicotine in it. Like 99% of them have nicotine, and if it doesn't, or it says there's not, there probably is. The FDA doesn't regulate, so there are times that the nicotine content is not posted on the actual device or the liquid. Other things that are in the liquid include things like acetone, lead, formaldehyde, arsenic. It was kind of interesting to see that Johns Hopkins School Public Health did a research and did some testing and found that 10% of vapes that they sampled had arsenic in it. Also includes acetylcholine, which is a weed killer. So it's got some not so good things in the vape liquid. E-cigarettes can also be used to vape things like marijuana, cocaine, and other drugs. A few of the more popular vapes that we were kind of told are common by some youth at another school are what you see here on the screen. They have pretty color. If you look, they've got nice flavoring. That's all very appealing. Tobacco companies spend billions of dollars every year in advertising to try and attract or addict a new generation of users. And that generation of users are youth. Junior high, high school, and some even younger. It's not enough that our regular cigarette companies push cigarettes. also help push e-cigarettes as well, so that they can help get some of that market share by getting the younger generation. For example, Cool Cigarette, they produce the blue e-cigarette. Marlboro produces the Mark 10, and Camel produces the Views. I need some help. Vaping, why is it an epidemic? E-cigarettes are commonly used among youth today. Some of the statistics show that youth are more likely than adults to use e-cigarettes. In 2018, there were more than 3.6 million U.S. middle and high school students that used e-cigarettes in the past 30 days when they were asked about the use. 4.9% of that was in middle school and 20.8% was in the high school. Also, e-cigarette users aged 45 and older in 2015, most were either current or former regular cigarette smokers, and 1.3 had never been cigarette smokers. However, for those aged 18 to 24, 40% had never been regular cigarette smokers. So you can see that attraction and that ad campaign to attract that younger generation is working. Over the past several years, we've seen the use of regular cigarettes among the younger generation, teens, decrease. However, the use of e-cigarettes has exploded, making a comment that it is the epidemic and it has created a lot of serious health conditions. Again, this is mostly due to the marketing and trying to get those teens and younger people to try the product and get hooked. An article from the New England Journal of Medicine reported a 10% increase in adolescent use of e-cigarettes between 2017 and 18 alone. And that number is an astounding 1.3 million teenagers. Store signs, television ads, social media, internet, magazines, newspapers, they all use sexual content, identifying independence or rebellion, and the use of celebrities to try and get people to try their product. When you think about all of these methods of advertisement, 4 in 5 middle and high school students are exposed to these different types of media or types of advertisement. When you ask teens why they smoke, they have a variety of reasons of why they will say they smoke. A lot of it is for curiosity. They don't really know a whole lot necessarily about it, but maybe a friend or family member uses, so they're kind of curious about the flavor, how it makes you feel. So that's how they will try a vape. They are very attracted to the flavors. I think I read somewhere that there's over 7,000 different flavors for e-cigarette liquid. Also, sometimes they say that it makes them relax, which we kind of joked a little bit today. I said maybe I need to walk into the school vaping so that I can relax about being up here. We thought that probably would be a real good idea. So, and then also sometimes to just feel cool, they try to fit in with their peers. Makes them feel like they're part of the group. vaping bad? There's lots of reasons for that. A lot of times people use vaping thinking or feeling that it is less dangerous than actual smoking an actual cigarette. This is false information. Again, another attempt by the advertising to lure youth in to smoke, to try the product. A lot of the e-cigarettes actually contain higher concentration of nicotine than a regular cigarette. For an example, Juul, which is a popular e-cigarette, has about 5% or 59 milligrams per milliliter of nicotine, and that's actually equivalent to a pack of cigarettes. Studies show that vaping often leads to smoking regular cigarettes and can be a gateway to other drugs. Statistics, if you look different places, different statistics kind of pop up. They vary a little bit, not a whole lot, but it shows, statistics show that people who vape are 1 in 4 times more likely to end up smoking regular cigarettes. The health risks of smoking and vaping, there are lots of them. Vaping has not been around long enough to do long-term identification of long-term illnesses. However, we know that smoking causes a variety of health concerns that include lung injury, like COPD or chronic obstructive pulmonary disease, heart disease, several different kinds of cancer, most common lung and bladder cancer, as well as increasing the risk for people to have a stroke. Those who are exposed to the secondhand smoke can also be affected and are at risk for those conditions as well. Our brains develop up until about the mid-20s. So when you put nicotine in your body, it affects your developing brain, and it interferes with your learning, with attention, your attention span, with impulse control, and with mood. The body gets addicted to nicotine, and if anyone has ever smoked and tried to quit smoking, you go through a nicotine withdrawal. And some of those side effects are inability to sleep, irritability, trouble concentrating, feeling anxious, and being depressed because your body's craving the nicotine that you're now not giving it. And then EVALI, which is e-cigarette or vaping use associated lung injury. This too is kind of a new disease out for review. I'm still looking at the effects and trying to get more data and understand it. The course of the disease is really not predictable at this point because of the newness of identifying it. However, 96% of the people who have EVALI end up in the hospital for treatment. A lot of times these injuries or these disease processes are long-term, they're chronic. You now have to live with them for the rest of your life. So when you decide or you're thinking you might want to do it, think about that as well. You don't have control once you have those chronic disease conditions. It's symptom control and trying to manage it. Some of the treatment for the EVALI is steroid treatment, oxygen. Sometimes you can't get the oxygen levels high enough where they need to be to sustain life, so people end up being intubated and put on a ventilator for a period of time until they can be brought back to acceptable oxygen levels. Then antibiotic therapy and antivirals as well. There have been many cases reported deaths from EVALI. Also, with EVALI, don't just have those respiratory symptoms of shortness of breath, cough, or chest pain. You can have gastrointestinal, like nausea, vomiting, diarrhea, stomach pain, and you can also have non-specific symptoms like fever and weight loss. You also have an increase in the bacteria in your mouth, which then predisposes you to mouth teeth decay and gum disease. Because you have to have some type of a heated mechanism with your device, usually it's batteries. Your batteries can cause a fire and they can also explode. Most of the time these incidents have been noticed or noted when the device is charging. However, they can occur when you're using it to vape as well. Some people have been poisoned by swallowing, breathing in, or absorbing the e-cigarette liquid through their skin or through their eyes. If you think about the high content of the nicotine in some of those pods, you can understand if a small child or a pet were to get a hold of it, what would happen. It would be very devastating because it would likely kill them. In 2011 to 2014, poison control calls have increased from 271 to 3,957. So you can see the seriousness of the potential for getting poisoned and what bad effect or ill effect it can have from that as well. I was noticing the other day when I was looking through a medical record from the hospital in a case that was not related to any of this, but doing some follow-up and noted that when they do a social history now, included in that used to be the tobacco and your alcohol, but they now have a section on e-cigarette and vaping. And the questions include whether or not you've ever used, and then what your substance that you're vaping, nicotine, THC, CBD, or flavoring, and what type of device you have, disposable, pre-filled or refillable cartridge, refillable tank, refillable pod. So again, trying to get more information to be able to accurately and predict and maybe plan better treatment or better care should people get sick from those things. One paper that I had laid out on the table has talked about what happens when you stop smoking. It's pretty amazing to me that after 20 minutes your blood pressure and your heart rate fall back down to within normal limits. 12 hours after you quit, the level of carbon monoxide in your blood lowers to normal. 2 weeks after quitting smoking, your lung function and circulation improve. 1 to 9 weeks after you quit smoking, the tiny hair linings in your lungs, called the cilia, begin to work again, cleaning your lungs and reducing your risk of infection. Coughing, shortness of breath becomes less pronounced. A year after you quit, the risk of getting coronary artery disease is half as high as smokers. 5 years, the risk of getting mouth, throat, esophagus, and bladder cancer is half of what it is for smokers. And the risk for cervical cancer and stroke decreases as well. 10 years after, your chance of dying from lung cancer is half, and your risk of contracting pancreatic or larynx cancer also decreases. So if you smoke now, the message is pretty clear. You should stop. There are places to get help. If you would go on the internet and look for help stopping to smoke or stopping vaping. There's all kinds of resources available out there. What can we do as parents? Definitely talking to your kids is the number one thing. And it's not always very easy to do that. But you want to keep your conversation going with your kids. By yelling at them, criticizing them, is not the way you're going to get open discussion from them. But you need to be supportive and you need to try and listen more and talk less. Don't freak out if they're asking questions about smoking or vaping. Just because they're asking questions doesn't mean that they're doing it. Look at where and when you're holding the conversation. You don't want to just go in and sit down where your child is maybe watching a program and start a conversation out of the blue about vaping. They're going to be annoyed with you and probably not pay attention or not answer any questions that you might have. Taking a look at potentially, I know I kind of chuckle thinking about my own two daughters who are 20 and 21 now, but a good time to talk with them was in the car. It's kind of non-threatening if they're sitting in the back seat and you're driving. Hopefully they're not on their cell phone the whole time, that you can at least have a conversation. But they can avoid eye contact with you, which makes them feel less threatened and maybe more willing to have a conversation with you. So that's one place you might think about that. Maybe at the dinner table might be another place or time that you could have conversation. Keep your touch points quick. The more you talk and the more you drag on, you lose their interest and they don't really care to hear what you have to say. So keep things quick. Look for teachable moments. Don't use their friends, if friends are vaping or smoking, to use them as the person you're trying to, they feel like they're being judged, their friends are being judged. But use that opportunity maybe if there's a commercial on, or there's some other context where it fits in. Remember, it's okay to not have answers. We don't have all the answers. As parents, we like to think we have all the answers, but we don't. There's always places, again, to look online. Health resource advocates, we're here for suggestions or for help as well. And we want to work and partner with you to make our kids healthy. One other major thing is to kind of walk your talk. If they see that you're smoking or vaping, chances are they don't feel that your whole heart is in it either. So your stopping is helpful as well. And then just some true or false statements. Smoking e-cigarettes are safer than smoking regular cigarettes. That is false. E-cigarette aerosol is harmless water vapor. That is false. E-cigarettes can contain other harmful substances besides nicotine. Yep, we talked about that. Some of the pesticides and the metals, tin and lead and those things. Using e-cigarettes can increase the risk for future addiction to other drugs. Doesn't mean that it's going to happen, but the incidence is there, and it does show that there is potential risk for that. There are no long-term effects of smoking e-cigarettes. That is false. And smoking remains the leading cause of preventable disease, disability, and death in the United States. And that is true. Thank you for being here and for watching, and certainly if you have any questions or if you have other topics that you would like us to work on for presentations, 4.org.